We are here to serve the patients. They are our principal customer.
All of medical care should be about what's in a patient's best interest.
We're here to serve the patients, the women, the babies, the children, the families of the Wirral. We have to have them as the focus of what we're doing, at the heart of what we're doing.
It's all about the patients. The patients is what we look for to make sure they're happy.
At the end of the day, we're trying to make them feel better, and that isn't just about clinical outcomes, that's about the whole way we treat the whole person, and part of that is how we communicate with people, the values that we exude, and at the end of the day, how we make people feel.
Because it doesn't matter what the person's background is or ethnicity, anything about them, but there for your health.
It means not judging them in any sense at all, respecting their feelings and their thoughts and their opinions, and working together in a partnership.
It's respect. Works both ways, doesn't it?
As the chief exec, I have to own the overall performance of this organisation. But I think it's important to remember that this is our hospital.
Our hospital is your hospital, and we never know when we're going to need it.
To be proud of what we do, we need to own what we do. And to own what we do, we have to have ownership of our work, our workspace, ownership of the products, the outcome.
You need to have a strong sense of ownership, because you know that at the end of the day you are dealing with patients.
It's just getting that bit of a personal touch in there and just going that little bit step further.
Unity is important because to get the best healthcare outcomes for the patients we serve, we have to bring together many different people and different disciplines in what we call integrated seamless pathways of care.
Having a shared goal within the hospital and caring deeply about quality and the level of care that each patient gets is really important.
We're working more now as a multidisciplinary team, so it's not just about nursing care, it's about physiotherapy, it's about occupational therapy, it's the doctors, it's the ward clerks, it's working together as a team and being able to make sure that we facilitate safe discharges for patients and make sure that they're safe whilst they're in hospital.
If you're part of that team that's helped somebody, or if it's a child that's really poorly, you are part of that team, and that's what makes it worthwhile.
Sometimes the impossible is made possible, and that's because of the team.
We have a lot of highly skilled, highly trained people who've spent a lot of years getting to that point. What we want to make sure is that we are then dedicated to making sure that we use those skills and capabilities to the very best possible outcomes.
If you don't like something, you don't do it. But once you are doing it, you have to do it with all your heart, with all your mind.
It's what we do and it's what we enjoy, and we're passionate about it.
I love my job. I love it. I think as soon as I put my uniform on, I take pride in it.
We're lucky with the services we do. To be able to work here, to be able to support women, babies, children and families is fantastic.
We need to be passionate, we need to be committed, we need to be energetic, we need to make sure that no matter what else is going on in our lives, that we can come here and do something that really is meaningful and provides a purpose.
I'm proud to work here, just to know that each day that I come to work I'm making a difference to women, their babies and the wider family.
Everyone pulls together on a daily basis. Everyone has a good heart and is doing their job for the right reason.
That's what makes me proud.